Hello, my name is Portia Wilson and I'm a student at Albany State University in Georgia, and I'll be doing a presentation on cholesterol control and health promotion. You may not be able to see me the entire time of the video because the trifold board is like kind of far away. So at the end of the presentation I'll actually take the camera and try and get a little closer to the trifold board so you can actually see the things that are actually on the board. So in order to promote health, we as healthcare providers, we have the responsibility to screen our patients and be able to identify known or potential risk factors, educate regarding the risk factors, provide education about positive lifestyle changes, and discuss how these lifestyle changes can impact health. And in order to promote health, improve quality of life, and extend life expectancy, health promotion must take place. Now, healthcare and health promotion are essential because I'm sure that you or someone in your family, you've been told that you may have high cholesterol. What is cholesterol? Maybe a question that someone may ask. Or how did I get it? What can or will it do to me? How will it affect my life? And we'll also talk about the influences of diet, lifestyle, and genetics, lipids, and how they are transported in the blood. Cholesterol is a type of fat. It's in all of our cells. The body actually needs cholesterol to work properly, but having high cholesterol can increase your risk factors for heart disease. Cholesterol travels through the bloodstream to get to all of your cells. And protein, it forms a shell around the cholesterol, and this makes what we call a cholesterol complex. The cholesterol is released into the bloodstream and it travels to where it needs to go. This protein that is linked to the cholesterol, it's called a lipoprotein. Now, I'm sure you've heard of good cholesterol and bad cholesterol. The lipoprotein that is called the bad cholesterol is actually called LDL. LDL is a low density lipoprotein. LDL cholesterol, it builds up in the walls of your arteries and it makes them hard and makes them narrow. The good cholesterol, which is called HDL, HDL is the high density lipoprotein, and it picks up the excess cholesterol and it takes it back to the liver. And this is like a diagram here that just kind of shows the transport and how it actually goes back to the liver. Now, cholesterol from the diet, it ends up in the liver, and the liver takes this cholesterol and it sends it to other tissues in the body that may need it. Now, other tissues can send excess cholesterol back to the liver. And the cholesterol actually comes from animal products. So vegetarians usually don't have high cholesterol. They usually have low cholesterol because plants don't make cholesterol and cholesterol don't grow on trees. So cholesterol through our diet, if we don't take it in through our diet, then the body actually has the ability to make cholesterol. Now, triglycerides. Triglycerides are another type of fat, and they are found in the blood. Now, your body uses triglycerides for energy. You need some triglycerides for good health, but having high triglycerides can raise your risk of heart disease and may be a sign of metabolic syndrome. And metabolic syndrome is, the round kind of belly, and you have like central obesity, high blood pressure, high triglycerides, low HDL cholesterol, as well as insulin resistance. Now, the risk factors for cholesterol, we have modifiable risk factors as well as non-modifiable. And the modifiable risk factors are things that actually are within your control. Say, for instance, being obese, having a body mass index that's actually above 30, an unhealthy diet, eating red meats and full fat dairy products will all increase your total cholesterol. Now, saturated fats in animal products and trans fats can also raise your cholesterol level by contributing to a high LDL and a low HDL. Now, cigarette smoking, it also damages the walls in your vessels by making them likely to accumulate fatty deposits. Now, high blood pressure, diabetes, as well as lack of exercise are all modifiable risk factors, meaning that you can do something about those things. So the non-modifiable risk factor, these are things that are beyond your control. Say your genetic makeup. Your genetic makeup may keep your cells from removing LDL cholesterol from your blood efficiently, or it can cause your liver to produce too much cholesterol. So another question, what will it do to me? Well, high cholesterol can cause atherosclerosis, which is a dangerous accumulation of cholesterol and other deposits on the walls of your arteries. These deposits, they are called plaques, and they reduce blood flow that actually goes through your arteries, which can cause complications. What kind of complications? Well, it can cause things like chest pain. Say if the artery that supply your heart with blood, say your coronary arteries, if you have like if they are affected, you may have things like chest pain, angina, or other symptoms of coronary artery disease. Say a heart attack. Say if you have a plaque and this plaque tears off, or if it ruptures, then if it ruptures, a blood clot may form at that site, and it may block the flow of blood and may break free and plug an artery, meaning it's actually done occluded the artery, and this will cause you to actually have a heart attack. A stroke, say if you have blood flow to part of your brain, if that's blocked, of course, that can actually cause you to have a stroke. So there are major risk factors in developing cardiovascular disease in having high cholesterol. So lower your cholesterol. High cholesterol has no symptoms. A blood test is the only way to detect high cholesterol. You need to see your doctor. Ask your doctor for a baseline cholesterol test at least age 20. Have your cholesterol retested at least every 5 years. And if your test results aren't within normal limits, and or you have a family history, then your doctor may recommend that you actually have more frequent tests. And also with cholesterol, you need to know your numbers. With the total cholesterol, it is recommended that your total cholesterol be below 200 in order for it to be in the desirable range. Anything between 200 and 239 is considered to be borderline high, and anything above 240 is considered to be high. Now your triglycerides, they should be less than 150 to be within the normal range. 200 to 499, less than 150 for it to be in the normal range, 150 to 199 for it to be borderline high, and 200 to 499, which is actually high. And anything that's over 500 is considered to be very high. And as far as your HDL, the HDL, anything that is above 60 is kind of high optimum. For men, they want you to be less than 40 and less than 50 for women, which will put you in the low risk factors category. Now, as far as treatment for cholesterol, you can use different modalities of treatment. In pharmacological treatments are statins, and statins are most common. They block a substance in your liver that's needed to make cholesterol, and this excuse me, causes your liver to remove cholesterol from your blood. And the statins may also help your body reabsorb cholesterol from built up deposits on your artery walls, potentially actually reversing cardiovascular disease. And there's also bile acid binding resins, and they actually reduce the levels of cholesterol in your blood. Now, there are also the cholesterol absorption inhibitors, and they, in your small intestine, the small intestine absorb the cholesterol from your diet, and then it releases it back into the bloodstream, and the drug, say Zetia, will actually kind of help reduce the cholesterol by limiting the absorption of dietary cholesterol. And then they have like some combination treatments as well, the combination cholesterol absorption inhibitor along with the statin. And the combination drug like simvastatin, it actually decreases both absorption of dietary cholesterol in your small intestine and and production of cholesterol in your liver. But it's kind of unknown whether, like the drug Bytorin, if it's more effective in reducing heart disease risk than the simvastatin is by itself. And there are also, you can also do cholesterol lowering diets, and they're like, I got like 5 top foods that will kind of help you lower your cholesterol, and that's oatmeal, oat bran, high fiber foods, fish and omega-3 fatty acids, walnuts, almonds, and other nuts, olive oil. Now, olive oil contains a potent mix of antioxidants that can actually lower the LDL, which is the bad cholesterol. And foods with added plant sterols, and those are things like margarine, orange juice, yogurt. They all have that added plant sterol, and it actually will block the absorption of cholesterol. So now I'm going to just take the camera and get a little bit closer to the triboard, so maybe you can get a depiction and see actually what's being depicted on the board. So this is just the introduction, and down here is just talking about healthcare and health promotion. What is cholesterol? How did I get it? What can or will it do to me? Talking about cholesterol as a type of fat, and it's just a diagram showing you how it can actually build up and clog into the in your arteries, and how it travels through the bloodstream and forms the protein, which turns out to be the LDL and HDL, the low density and high density lipoproteins. And these are talking about the low density and high density lipoproteins. And this is just a diagram showing you how it's transported back to the liver. And this is talking about how cholesterol from the diet actually ends up in the liver. And then your triglycerides, and how they are a type of fat that are found in the blood vessels that can lead to metabolic syndrome. And this is what metabolic syndrome looks like. And then we also talked about the risk factors. the modifiable risk factors and the non-modifiable risk factors. And what will it do to me? How it can cause atherosclerosis, which is a dangerous accumulation of cholesterol. And there it can cause the chest pain, heart attack, and stroke. And we talked about the major risk factors in developing cardiovascular disease and lowering your cholesterol, talking to your doctor, making sure that you get that baseline cholesterol test done. And right here we're talking about, we didn't talk about the, here in North Carolina we have the Department of Health, and they have neighborhood clinics, and these clinics are held each month in our community in order to serve persons who have difficulty in getting to the health departments. They are actually intended for adults and children who do not have private doctors. And they also have 2 clinics, and these are the clinics here that are listed below. And the first 2 clinics below, they actually offer services which include health screenings, immunizations, and laboratory testing. All these services are free of charge. They're walk-ins only, there are no appointments, and they're provided by registered nurses from the health department along with volunteer physicians. And the Rescue Missions Medical Clinic only provides health screening every Thursday, and dental extractions are actually done on the 2nd and 4th Thursday. Hopefully this information was beneficial and educational to you. Thank you.